the last 30 years, I have said I want to change the medical model in this country. And lots of people talk about that, but I feel that holonomics is actually a way to do that. By changing the way that medicine is approached and having different information in play that takes into account more information than the present medical model, you have a better model. Now, Einstein likened new models not like building a taller skyscraper, but more like climbing a mountain and looking back at where you used to be and seeing it in a broader context. And see, holonomics doesn't conflict with anything you already know. It's consistent with all the medicine that you've already been taught if you're a doctor. But what is different is it gives you a way that is grounded and scientific to take into account information that is not part of the regular medical model. As I said, one of the charges I had when I was professor and we were doing this curriculum reform was actually to look at what happened when the doctor walked into the room with the patient. What was going to be different? And in holonomic approaches, the context in which you see the patient coming to you is different because you take into account other elements of what makes a patient come to you. And even when you look at the patient and you look at their structure and their posture and how they move and how you take into account what they're feeling, you understand that differently when you use things like perceptual transference and body-mind to take into account the physical complaint that the patient is presenting with. As you do the physical exam, because you touch the patient and you feel what is happening inside their bodies as you discuss it, you have a completely different understanding of the patient's personal feelings about what's wrong, the actual physiologic processes that you're witnessing with your hands, how that correlates with their autonomic nervous system and physiology and even their pharmacology, how they're medicated, and then how we use that information to interpret how bad the problem is, how much of it we can reverse with manipulation on the spot versus how much wants to persist, and so we have to look for the causes of whatever's disturbing the system. And the notion that these point attractors are operating in the system, we can jump back and forth about point attraction in the chest and talk about muscle dysfunction or cardiac dysfunction or autonomic dysfunction or pharmacology or cardiac surgery. We can do all that, and everybody knows where everybody else is. Even your acupuncturist could graft onto this and understand what everybody else is doing with a holonomic model. So it is a broader way to understand medicine, and it changes what they do in the rooms as well. Now, on the treatment end of it, because you also physically treat the patient and observe how they respond to treatment, you can prognosticate about reversibility and the severity of a condition in ways that are relegated to who do you believe in regular care. The physical examination techniques that are taught to most doctors are pretty perfunctory in terms of mashing on things and identifying masses and organomegaly and things of that nature. But these approaches provide you with a snapshot of the entire body and its physiology and how it's reacting to what's wrong that MDs are taught not to even think about, much less try to take into account. The reductionist model has limits that are designed into it, and the holonomic model, because it's all inclusive, leaves out nothing. And so from the time you walk in and assess the patient and go over them to the time that they walk out the door after you have treated them and design their treatment plan, holonomics changes how you understand the patient, and yet you still don't deviate from your medical understanding of the patient and what is considered good medicine. It changes what's important. Now, the definition of philosophy is a system of hierarchy, and that's why osteopathic medicine, where you take structure function into account, and holonomics, where you interpolate this information relationistically with everything else, is a powerful tool for the young medical student as well as for the patient to model health. And as Dr. Still, the founder of the osteopathic profession, said, find health. Anybody can find disease. And this is the roadmap, the scientific roadmap for what health truly means. Because remember, your natural state is health. I tell my patients, no one can take away your perfection. And see, many patients who are sick are really afraid that they've lost any chance of recovering their health. And see, their perfection is a geometry within them, and it can't be taken away. It emanates from your cells. That can get distorted, and those distortions are what we call aging and disease. But no one can take away your perfection because it's a geometry within you. And see, Holonomics takes that into account. So between perfection and oneness and reversibility and triviality and strange attraction, these ideas give you a completely different way to understand your patient and what health and the goal of treatment really is.